I'm super excited because, I think people always laugh a bit or kind of say, how did y'all end up working in Appalachia? Or how did y'all end up working in West Virginia from where you came? And a part of how CEG landed here was, as I, always give the analogy, and I'm going to give it again for those of you that have heard it a million times, of the growing syndemic in Appalachia. I say that the engine of that train has been originally was injection drug use, and then it went to poly drug use, with the next car being hepatitis C, hepatitis B, hepatitis D, hepatitis A, economic development challenges, workforce development challenges, educational attainment challenges, the caboose of that train being HIV, but each of those cars being laden down with coal. And what I mean by that is the environmental impact, the economic impact, and I think the psychological impact of whether it's coming back or whether it's not coming back, what has it done to families, neighborhood toddlers, and that sort of thing. But in the forefront of that has always been one organization and one group, and that's the Appalachia Regional Commission. They've led the way in health, economics, workforce development for decades. So I'm super excited to have them today to talk about kind of the work that they do, so we can ask them some questions about resources, resource opportunities. You guys know I'm going to talk about opioid abatement, which is my favorite thing these days, but also going to hear about some of the work that one of our neighbors is doing. And so I'd like to first introduce you to Commissioner Denis. Commissioner Denis, you want to tell the folks who you are, what you do, and why you do it?
Sure, be glad to. I'm the commissioner of the Department of Local Government located in Frankfort. I'm a former general representative in the Kentucky House. I was there for 15 years. I've been on city council. I've been an entrepreneur all my life. And then I've got this job, which has turned out to really be a challenge for me. I enjoy it immensely. You get to impact a lot of everyday people's lives and makes the dreams come true. So it's been a very important role that we have. And ARC funding is critical to getting some of that stuff done. We operate underneath a group, what we call our ad directors. And there's, I think, 15 ad directors around our state, which 5 of them are located in the ARC region. And we rely on those ad districts as our boots on the ground. They're the people that help the cities and the counties to apply for grants, to write the grants, and then to help filter them up through us. And without the ad districts, they're just a tremendous partner for us.
All right, Commissioner, I'm going to come back to you because you said a whole lot in there. You told me that there's commissioners on the ground, there's people with boots on the ground. You told me there are opportunities to write in grants. You're telling me that ARC's got money and that you can even help them write a grant. That's what I heard, but I'm going to come back to you now. I don't know if that's what you meant to say, but that's what I heard you say. But you know, they put me in charge of the mic. I don't know why. So I'm going to do this in a different order. Lauren, I'm going to come back to you last because I want to get to my good friend Guy, who's I think has been at ARC since Hector was a puppy and is a big dog now.
Thanks, Tony. Let me say that Federal Co-Chair Gail Manchin is looking forward to joining you. I believe it's in April that's been set for now. Tony invited her the other day and Gail said yes, and realized after the fact, oh, she was committed to meeting with the board, the regional board of those very area development districts that Denis was talking about a minute ago. And ARC, as I think most of you know, but then by the way, I see several familiar names here, Fred Rader, Bob Hanson, and others that we have a good history with. ARC is a federal state partnership consisting of a federal co-chair appointed by the president, confirmed by the Senate, and the governors of the 13 states we serve. And Denis's boss, Governor Beshear of Kentucky, is the lead governor for the states this year. Healthcare has been at the heart of ARC's mission in one way or another from the time we were created in 1965. The act that created us created a special health demonstration grants program that we used to build a network of, roughly 400 clinics around the region under the organizing framework that we want every Appalachian to have access to a primary care facility within 30 minutes of where they live. And we had a health advisory committee to help guide us that was created in the late 90s, early 2000s. And we transformed that later into a Substance Abuse Advisory Council. And Lauren will get you more into the details of the substance abuse work. Bob had helped us a lot with that as we were going forward. We have tried to focus on a broad range of health issues, not just the substance abuse, but other health challenges in the region. And Tony, you were describing the cars in that train, and ARC tries to address, tries to lighten the load of some of those cars along the way through our programming. But health and ultimately for us, it's having a healthy, competitive workforce. The goal is to get the most value of contributing to the economy by the people who work in Appalachia. And to do that, you need healthy people, and that means helping them deal with substance use disorder and ultimately getting them back into the workforce. We were, since this group is particularly focused, I think, in part on prescription drug issues and opioids, we did the very first study that demonstrated the disproportionate impact of prescription drug abuse in Appalachia. We released it in 2008. We thought going in, the drug problem was meth. And when we went and did the research, and Michael Meat with the National Opinion Research Center did the work for that, determined that, well, actually, no, it's not meth, it's prescription drugs. And that laid the foundation. We unveiled it, Denis. We unveiled that study in London with the current Governor Beshear's father, as a matter of fact. And then about that time, Congressman Hal Rogers got engaged with things with Operation Unite, with the Prescription Drug Summit, the National Prescription Drug Summit, that we put the initial $50,000 in that helped create it. When they were hoping to have, good side, 350 people maybe, to the first one, they had about 700. And today, as you know, they've got between 2,000 and 3,000 people that show up for that conference. But anyway, that's just a real quick.
So, but before I go to Lauren, and this is something I don't think a lot of people know, is what my understanding is that ARC, the Appalachia Regional Commission, was founded originally as a part of Kennedy's War on Poverty. Is this right, or is this have I mixed up my history here?
Well, first of all, Tony, you've got a good grasp of history, and we're not familiar with you getting key things mixed up. The background is that Senator John Kennedy, when he was campaigning for the presidency in 1960, was visiting West Virginia. The West Virginia primary was to be a hotly debated race that could determine who the Democratic nominee for president would be in 1960. And so this senator from Massachusetts, from a relatively wealthy family, visiting West Virginia on multiple occasions and seeing the distress and poverty in the mountains, but particularly in West Virginia, promised the people that if he were elected president, that he would take steps to address the economic distress that he was seeing around him when he visited West Virginia. And that ultimately led to the creation of the Appalachian Regional Commission. It didn't happen until Lyndon Johnson became president, but it was an outgrowth of a commitment that Senator Kennedy had made when he was campaigning to be president. So you're absolutely right.
Perfect, thanks. And I think that, I know sometimes people don't know where these commissions come from, how they pop up, but there was an important piece of that, and that's, a part of our work is really to kind of make sure that we highlight, respond to the culture and the cultural needs of the region. And I think that that's what he saw. And most of the things I've read is that he saw that while there was poverty, there were poor health outcomes here, but there was also a vibrant culture here that he wanted to preserve as well. So Lauren, you are now in the seat of driving am I getting this right? Driving the substance use disorder train on this thing?
That's right. Yes, absolutely, Tony. I appreciate how you frame that. And Guy, I have to say, you are such an encyclopedia of all things ARC and Appalachia. It's just a breath of fresh air. I learn something new every time I speak with you and hear from you on calls like this. Tony, thank you as always for having ARC on. And it's definitely been a pleasure to work with you all, I think over the last year, but definitely over the last couple of months in your Inspire project, focusing on community health workers. But so yeah, for those not aware, Program Manager Lauren Wood, I oversee our health portfolio, but more specifically our substance use disorder Inspire initiative. And Inspire stands for investment supporting partnerships and recovery ecosystems. Henceforth, I will always just call it Inspire because it's such a mouthful. And I think as certainly the conversation over the last 10 or so minutes has gone as right, you all kind of are working across a number of health disciplines in the Appalachian region, not just the SUD space, but as Tony always harps back to, is really addressing the syndemic in our region. And I think that's where in many ways the Inspire Recovery to Work initiative was designed with those broader health disparities in mind, right? So even, suicide, infectious disease, certainly a lack of access to healthcare due to just kind of the broad rural nature of Appalachia. And more specifically with, through the recovery ecosystem and within that context of ARC, us building and strengthening economically resilient communities in Appalachia, that's where we see Inspire as a complex linkage that I'm sure if I knew every single person on this call, I could map out how each and every single one of you are part of, whether you know it or not, part of building the recovery ecosystem in one way or another in your communities. And that'll certainly tie back to, maybe down the line here in the next 30 or so minutes of the call, get into Inspire and some of the nitty gritty is these partnerships and this community collaboration, and outside of just kind of evaluating and identifying what your community needs are, but who those partners are, right? Whether it's your neighbor next door or, if you're a federally qualified health center, reaching out to your Chamber of Commerce or your Workforce Development Board to understand your community needs, most importantly, the assets, and building that recovery ecosystem. And in every way, that's exactly what all 84 of our grantees from New York to Mississippi are doing day in and day out through the Inspire initiative. So it's really phenomenal.
Perfect. Thanks, Lauren. Now, Commissioner, I'm going to ask you a couple of questions specific to Kentucky, because we talk about West Virginia a lot on these calls. Can you give us maybe some of the priorities right now that are going on in Kentucky related to ARC, but also maybe just related to some of the health indicators we just talked about, substance use disorder, HIV, PrEP, hepatitis, food and nutrition programs. Can you talk about this maybe?
Yeah, our challenges in Kentucky are the quality of life, but not only the quality of life, but along that goes with infrastructure that has to be put in place before you can have these jobs come in. We're doing a lot with what we call lineman schools, and we fund those lineman schools. About
Sorry, sir, what's a lineman school for those of us?
Those are people that are taught when your power goes out, they're the first responders to getting that electric back on for you. They're the guys that get out there in the bad weather and climb the poles and on, and they go to school for that. They just don't learn that. So the good thing about that, those are good paying jobs. And probably 95% of the people that we graduate have jobs from day one when they get out, when they complete their course. In fact, some places like in our area, we have Duke Energy, they'll pay the scholarship for the linemen to go to school. So we do things like that nature. We, as far as healthcare and that, we're very supportive of our healthcare clinics. We do some recovery work for people that are trying to get back in the workforce that need a little extra help. We help fund. We have a place it's in Clay County, and it's a women's recovery center. And they train the women for jobs, but also they help them with recovery and getting back on their feet. And a lot of times they're allowed, they keep their children. They don't have their families are not torn apart. ARC is very, very large in its scope. And if I might use this word, it's more liberal than most programs. You know, you can get it to conform to the problem. It's a square peg going in the round hole, so to speak. ARC's got that kind of luxury. We also couple ARC funds with some of our other funds, our community block grants of that nature. A lot of times, maybe we can't get all the asks from ARC. We need another $500,000 or some. In that case, we'll go to to one of our community block grants and manage that together to make a program, to fit the need. Also, we use rural development money. That's another resource we have. And then in Kentucky, we have coal severance, and that's more directed on the county level. That's the taxes on the coal that's shipped out of that counties. Mm-hmm. And there's really big numbers of coal severance taxes. Not as big as it has been in the past, but they're pretty good sized numbers.
So, one of the things that I think that Community Education Group and ARC have in common is that one of our kind of policy missions, and I know y'all don't talk about advocacy. I know you don't do advocacy. Please don't nobody jump up and down about the advocacy question. I'm not getting ready to ask an advocacy question. Everybody calm down, okay? Woo, I saw everybody get jumpy. But it's this idea. So for us, the way we're approaching it, I'll talk about what we're doing, is that we're trying to figure out a way in which, with every federal notice of funding opportunity, where we see Native American, Asian Pacific Islander, or other disproportionate communities, where we can see a semicolon and say, and the 423 counties of the Appalachia region. And the reason we want to do that is because so many of the 423 counties touch on more than one state. And I know that the commission itself is doing a lot of work with both Arise and Inspire to actually make sure that grants are multi-state so that they can in fact move across state lines. Can y'all each talk a bit about kind of your visions around being able to move money across state lines, the impact of being able to kind of have money move across partnerships across states? Hopefully that question made sense to you. Guy, I'm going to let you go first, because you went off the mic first, because I thought you think I was going to say you needed to do advocacy or something. You were ready.
No. Every word you say is advocacy, but it's permissible. Yeah, and thanks very much, Tony. Yeah, for those of you who may not be that intimately familiar with ARC, we reach from the southern tier of New York down to northeast Mississippi. And as Tony said, it's 423 counties, which are named by Congress in our act. So we only can serve counties that Congress has designated for us. And Federal Co-Chair Gail Manchin believes passionately that many of the challenges and opportunities that we face in the region are no respecter of state boundaries. And so we need to be thinking where, by states working together or entities working across state lines, they can have a greater economic impact for good than if there was just a group of disparate activities across several different states. So we have released, as Tony mentioned, an Arise, as we call it, RFP, where only multi-state activities are eligible. So you must be partnering with entities in another ARC state, and the proposals that we're seeing tend to have 3, 4, and 5 states partnering together. Gail often says that if you took the lines off the map and just looked at the area, or were driving through the area, you wouldn't know where to put the lines back down on the map because the conditions are similar, the geography is similar, the people are similar. And so we need to find ways to overcome those artificial jurisdictional boundaries that can sometimes retard the opportunities for good economic impact. Recognizing, however, that Congress created us as a partnership between the feds and the states. So there's a vital role for states in all of this. And a significant portion, above roughly 40% of our total funding, is distributed by formula to Denis and his colleagues in each of our states for their governors to decide, consistent with our strategic plan, how best to use those dollars to advance the governor's agenda in that state. And you heard Denis talk about the broad range of things that they do, particularly using ARC monies. but we're encouraging everybody to look at, and I know a number of people are looking in the SUD area about where there are collaborations across state lines that can enable those individual programs to have greater impact than just being standalone programs in one state or one jurisdiction.
Perfect. Lauren?
Yeah, Guy, no, I think that was a perfect segue, at least within Inspire. Well, let me start and say that we do have, some Arise ideas that are coming to the fold. And for those of you that might not be aware, Guy can speak much more to this because, again, he knows everything at ARC, but Arise came out of the infrastructure package. So implementation grants are up to 10 million. And I think planning grants are up to $2 million. So, certainly not. Okay, perfect. So obviously a ton of money that is ripe for the taking. And we have seen projects come in. Well, the one that we most recently awarded, I think $6.5 million to, was a broadband project across 55 counties, across all of the region, really. And others that are specific to health and even more specific to SUD are really taking that, because it's supposed to be, Arise at its core is large. So going back to Tony's comment of, multi-state, we want to see states, rather than thinking of themselves as the 13 states, as we're 26 million people. How can you use X amount of funds to get the most bang for your buck to, increase that sustainability and just, using those funds wisely. All of that to say, I would say from the Inspire side, we have seen historically less multi-state collaboration unless it's incredibly convenient. So for example, we have a West Virginia and an Ohio grantee that came together because their population, between a workforce development board and a FQHC that was over on the West Virginia side, they already had a kind of a seamless partnership developed because of just general community needs, because they have a ton of citizens that they're literally within a few miles of each other. So they're constantly going back and forth across state lines every single day, whether it's for work, health related needs, et cetera. So that was kind of an easy partnership for them. But I think when it boils down to it, another reason why we won't, and I hope that we do, I hope folks find, the loopholes in their state, or, where the assets are in their state to take advantage of a multi-state, Inspire, Arise initiative, et cetera, in the health space. But I think where we won't see that is because there's not a ton of parity from one state to another, right? So as a medical provider, I'm going to have to get licensed in the other state. Even if I want to provide telehealth services here, I might not be able to provide them there, despite the fact that, telehealth flexibility is significantly improved during COVID. There's just a lot of some of that bureaucratic, there's issues that are going to prevent our folks from doing that. Now, not to say that, opportunities don't exist. We just haven't seen communities or states through Inspire, come to the table yet, but I definitely hope in the future that we will see that.
Right. Now, so here's the thing that people are going to, when I hang up the phone call, my inbox, Lee's inbox, Trisha's inbox will be flooded with. How do we get in contact with them? How do we find out all of these grants that they keep talking to us about? How do we get any help with that? Okay, listen, I don't know. You call ARC. That's what you do. You go in so tell us about the ARC website, which I actually think is really great. Tell us about the health report, which I also think is excellent. It's an excellent resource that gets underutilized. And can you tell us, how does the average person who's on this call right now find out about opportunities with ARC within the states like Kentucky, but also from your federal perch? What do they need to do?
Go to the website. You're absolutely right.
What's the website? Tell the people.
Which is arc.gov, www.arc.gov.
Oh, so wait a minute. Y'all are a government entity?
So
you're a
no
commissioner,
advocacy, Tony.
You see how I did that? You see how I did that? You see how I did that? So y'all are a government entity. That's so people are getting these resources. Some of them might be the first time that they're able to get federal grants. Huh?
That is absolutely correct, Tony.
And is my understanding that you might offer some technical assistance to help them write those grants? Is there? I'm trying to lead you, man. Come on, help me drink here.
Well, what I want to do is pick up on something that Commissioner Keene said earlier, which is there are these, we call them local development districts. And in Kentucky, they're called area development districts that are very familiar. In fact, we give them dollars each year. They're multi-county planning and development agencies. Every one of those 423 counties is served by a local development district. They are very familiar with ARC monies, but not just ARC money, but a lot of other federal program dollars. And they are a good starting point to helping you put together an application. If it's in Kentucky, then it could be the Gateway Area Development District, just to pick one, that can help craft the proposal and then say, send this to Denis's team with the Department for Local Government in Kentucky. And every one of our 13 states has people on the state payroll looking out after ARC things and ARC applications. Our website, which again is www.arc.gov, gives you the contact info for the state people in each of our 13 states that administer the ARC program. And then our website also gives you links to Lauren's program of Inspire, our Power program for coal-impacted communities that have been adversely affected by the decline in coal. We have an RFP on the street right now, and we have funded a number of SUD-related projects under that program. Those tend to be higher dollar levels than the ones that are funded under Inspire. And you will also find the link for our Arise program. And that will tell you exactly how to compete, what you're looking for, and it gives you an email address for each of those three. If you need follow-up, you have questions or need follow-up information, each of those programs has an email box. I'm not giving anything away when I say Lauren reads the ones that go into the Inspire email box, but there is a person at ARC assigned to each of those who gets those emails each day and makes an effort to return them that day or the next day if at all possible, so that if you have a question, there is somebody there to answer that question. It doesn't just go into oblivion somewhere.
And before I jump to Lauren about this, I want to say that, you know, one of the things I always say, particularly when we do trainings or capacity building for nonprofit organizations throughout the region or throughout the country, is that so often people think that the government is just this giant bureaucracy and like there are no people engaged. I think that ARC is actually the epitome of what true government is. It is people, and they are accessible, and you can find them. They might not give you the answer you always want. I mean, it might be a hard, yeah, no, you can't do that. But you know, but the truth is that they're there.
No advocacy grant. Sorry, we can't fund an advocacy grant.
No advocacy grant for you. So, you know, but they, you know, but again, it's about being able to, and that's why we do these calls, right? It's about being able to get the opportunity to put a name with a face with a name, so that it's like, it's not this amorphous person out in the nowhere land, but it's actually somebody. You now know somebody in Kentucky. You now know the folks at ARC. These are the people. It's not some other people. These are the people. And so what you want to do is actually send those emails if you have a question. I also know that there's at Ready Appalachia, which I know the chairwoman is really hyped on about helping folks write those grants. Because one of the challenges is, if you're a small nonprofit, been in this region, how do you even write or compete for these big grants when you've got big organizations, you know, that have development departments and all this stuff? So she was like, hey, we need to invest in training people on how to write these grants and then to go back and help the very people. Lauren, can you talk a bit about that? I know you're going to talk about something else, but talk about that too.
Yeah,
I'm not trying to tell you what to do, because
no, and I'm happy to. Well, and let me just put a shameless plug here on everything that Tony said. I am obviously not biased by any means, now working at ARC for a year and a half, but I will say that most everyone I've met in our DC office, and even more so in our states, because they live in our states, they're our eyes and ears, right? Commissioner King, Scott Sharp, like his group out of Kentucky. everyone here in some way, shape, or form either has come from Appalachia by birth, or their family and their family history comes from Appalachia. We don't just, sign up one day for ARC and want to work here because it's, a great job and it pays what we're here because we love Appalachia. And we're here because we want to see future generations thrive and really continue to carry on that great culture and heritage that Tony always mentions. So on that note, in terms of being accessible, I will say that we have tomorrow, for anyone that wants more information on Inspire, and I'm going to put the registration link here, we have an Inspire pre-application workshop, totally free, totally virtual for you all tomorrow. And it's a great way, one, to ask questions, but even more so, and I put my email address in here. Guy, I will spare you, and I will not put your email in there. Commissioner King, obviously the same goes for you. But if anyone has questions on everything ARC, I will definitely say, I don't know most of, I don't know our division of critical infrastructure and our construction work, right? I don't know a ton about LDDs. I'm more in the health field. But if there's a question you have that I don't immediately know, I will automatically connect you with a staff member that will be able and willing and over the moon to talk with you on, all of your needs and help you, if not with the technical assistance grant writing side, but connect you to state program managers, folks in your state and else who can really help you craft the best program. And if not, also for ARC, just for your community in general. That to say on the technical assistance when it comes to grant writing, for those of you in West Virginia, Marshall University received an outside grant. I forgot where that came from, but to do pro bono work on all things grant writing for SUD health related projects over the next, I think it's 6 months. So if you are interested in receiving the Marshall University technical assistance on grant writing, email me and I'm happy to connect you to that group. We also have, through the Development District Association of Appalachia, who kind of oversees all of the LDD work. They're a great partner to them. They are doing recovery ecosystem building with us over the next 9 months. It's kind of a space is limited because we have a small group of people that are going to do that. But all that to say, email me. I will connect you with them so we can get you on the listserv. So if you're interested in participating in that with folks across the region, again, totally free and incredibly flexible timing. So I have no doubt that that's going to continue to move mountains through that work as well.
And it's not just Marshall, but WVU also, and not limited to SUD, but both Marshall and WVU have major grant from ARC to do grant assistance, including writing of grant proposals to federal agencies, not just to us. And it's at no charge, courtesy of the Appalachian Regional Commission. It was a very highly ranked power grant that we made last year. It technically is not, the word has not yet gone out, I don't think, on that, the public release of that, but just know it's in the pipeline coming forward. They expect to do a public announcement of it this spring.
All right. I mean, and anything we can do to help push that out to the group members here, or push it out through our newsletter. And I think that other groups here would want to do that for their members and their participants as well. We're ready. Again, I think that, again, what we're trying to do is show community in a different way. We're not coming to ask you for something, but we want to make sure that we're working in partnership and be able to push the information of the amazing resources and services that you have to offer and opportunities that you have to offer throughout the Appalachia region. And again, to know that people can access you. And so, Commissioner, it sounds like you're probably the guy that's reading some of these grants. So what's some of the stuff that you're seeing that people are in need of?
All kinds of things. It could be water, it could be healthcare, just all kinds of different training, educational opportunities, a myriad of things, what the mind can think of. But while we're talking about all this learning and all that, I want to plug, by virtue of us, our governor being the ARC federal co-chair, we're going to be hosting the conference this year, and we haven't found a site yet. We're still evaluating the sites, but it will be in Kentucky. It'll be in the Appalachian regional area, and it'll tentatively is scheduled for September the 10th. this year. It's a great place to network. I went to my first one in Maryland this past year. It was well received, and it's a good place to network with your colleagues that have the same concerns that you do.
And so this is the local, is it a local district, guys, or what is this meeting? Give us this is the ARC, the big ARC meeting. I heard that was one big party. I heard that's what I heard.
That's what Dennis promised.
I'm there with bells on, and some people said with little else is all I heard. I'm just trying to tell you that, and I'm not mentioning any names, guys. They said was doing what?
There'll be a lot of learning, but there'll also be a lot of fun. You're right. We have already lining up sponsors. Kentucky's known for its bourbon trail, and we've already had the bourbon distillery has been knocking down our door to help us out.
Well, that sounds like a good partner to have, at least for the first half of the event anyway.
Yeah.
So, we are about 20, it's like 20 more minutes. If folks have questions that they want to ask, if you could put them, because I know we have so many people, if you could put them in the chat, and I'll begin to kind of file through those. I think Elder White, you had you asked like 17 questions in the chat early on. Will you introduce yourself to the commissioners and to the folks at ARC, and maybe say kind of what some of your questions were or are?
This is Elder Denise White. I represent Bright Futures Now Incorporated and located in Charleston, West Virginia, and I work with Bishop Robert L. Haley. We do work around 5 major initiatives, one being educational attainment, economic development, health and wellness, legal assistance and support, and recidivism, as well as spirituality. We do monthly food distribution, where we typically access anywhere or provide support to about 400 to 500 people throughout the month. People walk in as well as come to our monthly distribution, and we've been working in partnership with CEG to do an annual health fair, and also with Health Right of West Virginia. So some of the things that you all are talking about, one of the questions I have, first question I have is, Dennis, what is your last name?
Keene, Keene.
Okay, thank you. The second question I had was about this partnership, and maybe Lauren can speak to that even more. It's about working across counties, working across states. Since we are getting and have received calls from as far away, believe it or not, Ohio, when we've done food distribution, or we're working in regional areas where people can't get to us and have issues surrounding food insecurity, public health, and a bunch of other things. How do we, or who should we, maybe that's a more better question. Who are the key stakeholders that are doing similar types of work that we can connect with to share resources, or at least share information about some of the other local agencies, local support systems that can help?
Yeah, Elder, it's great to see you, and thank you for being on today, and appreciate that question. I would love to be able to connect with you most importantly after this call, because I think that's a lot of ongoing kind of connections and collaboration with what you all are doing, and then not just our Inspire grantees, but a ton of our other ARC networks in the Charleston area. I mean, just as a brief example, I'm not sure how far away they are from you. I think about an hour, but Seed Sour is one of our grantees. They partner with Fruits of Labor to do culinary education. They do a lot of even training in event management, in catering, that whole world. They very heavily rely on their own curation of like an agricultural ecosystem in their community. So they're growing their own food, they're cooking their own food, and then distributing that out. And then they also have a pretty significant faith-based component to them as well. In a similar vein, you have Call-In 8, which is on, I think, the the south side of Charleston. And that is it's a female only. They've got a recovery housing facility, they've got treatment treatment facility. And I say that with air quotes because they're evidence-based, but they don't have the full kind of, swath of all treatment options available. It's more outpatient, but they also have it's a renovated old church. It's so beautiful. And I highly encourage you to go and visit them. And I'm happy to make the connection if you would like to. But it's a renovated church that they turned into a cafe. So they're also growing their own food in the church and on the kind of the outskirts of the church property. But they're teaching their girls in SUD recovery. Again, also the same trades, right? Cooking, kind of the entrepreneurial spirit of like how you start your own, food service business. They're getting them Serve Safe certifications. They're also connecting them to the faith-based entities, housing, just a number of other, partners that are in the Charleston community. Because again, as I said, partnership is paramount, not just within the community, but to the extent that you have those networks or assets are available in your region, in the state, or even across state lines. So I would be very happy to hear more about who you all are and what you do, and to connect you with other folks who you might not be aware of that are, Inspire grantees and beyond.
Perfect, thanks. And now I know that earlier, one of the things that Guy spoke about and Dennis touched on a bit, as did you, Lauren, was kind of the relationship of ARC to FQHCs and other federally qualified health entities. And so my good friend, Dr. Terrence Reedy, is on the call. Dr. Reedy, do you have any questions for ARC about how you're going to get money for your health department? Look, see, I did that. You're on mute. So before you start yelling at me, you might want to go off mute.
No, but I probably will need technical assistance, and it's good to hear that I can get some from Marshall. And
Perfect. So since speaking of that, I was actually going to call on her next. Lynn, are you still on this call somewhere?
I am. I'm here, Tony.
All right. So you were brave enough to put your flyer in the chat, which means now you know that we're going to mail it out to the 2,000 people on our mailing list. I think you knew that would happen as soon as I saw the flyer. So do you want to tell the folks what it is that you guys got resources from ARC to do? And again, the flyer is in the chat, and maybe we can put it in again now so people don't have to scroll back far to get it.
Yep, I can upload it again. I will say, so Marshall University Center for Excellence and Amy Saunders and her team are leading some of this grant writing initiative along with sort of some of the collegiate recovery. So there will be a lot more grant writing assistance and support coming out in the future because it was identified as a significant need. And Sarah Payne and her group works with Amy, and that's how some of this came together to get that grant writing initiative. If you are connected to your university system, they also should have grant writing education tools coming out shortly. Most, like Marshall's internal grant writing course, is in March. I know the WVU has one at a similar time. So if you know someone in a university setting, they often can connect you to one of those classes that might be related not just to ARC, but even NIH, HRSA, SAMHSA, some of the other big players, because each is different. Whether it be Match or, Match being a large component of ARC. But I would also just say, if folks have some issues, please reach out to us at Marshall, and whether that be for the grant writing help or as a partner. We have Creating Opportunities for Recovery Employment. That's an ARC power grant. We also have 2 Inspire grants with the Mountain Health Network, and just got refunded on another one to expand some employment opportunities. So we love working with ARC, and definitely go to the conferences. They're really fun, and we've had the opportunity to present there before. So we love working with folks on this because community partnerships that is such a key component of ARC that makes them great grants.
And we view Lynn as a star. So good to see you again, Lynn.
It's good to see you, Guy.
So Lynn, let me ask you this. So let's hypothetically say I'm Dr. Terrence Reedy, sitting over there in my health department, and I see this big federal grant, but I'm doing health department stuff. What do I do? How do I get, what do I do? I know you gave me the brochure, but tell it to me like I'm 2.
Well, I think one thing is that a lot of times there's people with ideas that are sort of working on these or know, for example, No Arise has been coming out and have sort of been working on those cross-community partnerships and sort of looking at a project. The good thing about some of these larger funding opportunities is that you can add more people to them. So rather than go it alone, find a project that fits, whether it be, you know, healthcare and, you know, social determinants, and then obviously a health department's going to fit right in there. Maybe it's the health department has a quick response team and you can plug in through that component. Maybe it's your health department has peers and you need more peer support or infectious disease testing as a component to helping someone get back into employment, right? Like figuring out how that larger system sort of is at play. And that's the reason that we've, I think, been successful with our employment projects are we looked at substance use and said, well, we can treat substance use, which we need to do, but if we can't get you back in the workforce. And so it was a unique take on that angle of substance use and working with employers and individuals. So to me, I think it's, if you have something that you're interested in, finding out who are other people who either have grants. So ARC has a list of funded partners. And so you can get with all of those folks, Seed Sour and Pollinate and us, and all of those are awesome people who know the process. And then they can link you also with some of the local funders who often support that match component, because that I think is the largest thing that you have to overcome with ARC, knowing the level of distress in a county, and it can be very overwhelming to figure that out. But we, you know, we can get someone who knows and latch on, and you know, so many folks in Appalachia are good partners.
So you'll help with that background data, like finding all those statistics and all of that stuff and helping me write it and pull it all together and helping me.
We've absolutely helped quite a few community partners do that and are always willing to support on those endeavors. Yeah, we need the help around here. So.
And so again, I just want to make sure I understand it correctly, and also to reiterate what I think I heard, which is that it doesn't have to just be an ARC opportunity. It could be an opportunity from SAMHSA or HRSA or NIH or the Office on Women's Health or the Bureau of Mines and Minerals. I mean, it could be.
I think, Tony, recently, you know, there was an organization we partnered with on an NIH grant. Their initial is escaping me. It's like CEG,
Somebody.
I think it is. Yeah. They have this phenomenal doctor, Dr. Holler, and, you know, we just loved working with them on that. But yes, you know, we helped with Boone Memorial's MAT treatment program. And, you know, when we can put some of the infrastructure behind folks and support them, we are often more than happy to do it. And that's how a lot of our community coalition projects have come about, is someone comes to Marshall Health and our division and says, you know, I want to work on this. How can we be supported? So I did see someone asked me if that grant would be relevant to the opioid settlement funds once those foundations. I think any grant writing initiative is going to be relevant because the foundation is going to release RFAs. So a request for funding announcement. And when they do that, you'll have to submit a grant just like ARC. And so once you know that process, it can be beneficial. And I know, Tony, you have a whole team of experts on those grant processes too. So.
Well, I mean, thanks, you know, and I think that it kind of makes us pivot a bit to opioid abatement dollars, my new favorite topic other than HIV cure research, which we'll save for another day. But I think that what I want to have maybe Tricia talk, I was going to call you by your last name, Tricia talk a minute about kind of what we're doing around opioid abatement. Then I want to hear from ARC about what you are doing on opioid abatement. And I know not yet. Don't look away. Don't look away. Don't look away. Don't look away. Now I know it's a not yet thing, but I just really feel like we have to have a plan now. We need some infrastructure dollars now, particularly because I want to build this big dashboard. So I'm going to be coming back to y'all for some of this money for this big dashboard I want to build. Tricia, go ahead.
So at CEG, we are tracking how the 13 states of Appalachia are managing their opioid settlement funds, acknowledging that every state has decided on their own process. There are some, very basic guidelines being handed down through the settlement administrators, but otherwise the states really get to decide for themselves how they dole it out immediately, and then, how they really are allocating funds for what types of projects. One thing that CEG is doing that we actually will be launching today is we have started this sort of low tech related dashboard. It's a spreadsheet, but it will be like a living document where we are tracking how at the county level, how decisions are being made about allocating opioid settlement funds. So we know that a lot of funds, there's many different litigations that have been settled, and they're coming in at different times. So some funding has already been allocated out in some states and in some localities. Other funding is still to be determined as far as the specific logistics, and we have many years for all this funding to come out. But we have been trawling through like county council meeting notes. Or I've learned because I've been working on Kentucky. In Kentucky, they call them fiscal courts because Kentucky loves their own language for all these things. But we've been trawling through, notes from those meetings, watching the recordings of these meetings, and noting when they talk about opioid settlement funds, particularly when they've made a decision about how to allocate those funds. And the idea here is on one side, we want advocates on the ground, and folks who are working in these areas to have an understanding of what decisions are being made and to sort of empower them to know that like you can go to your local county authorities and chat with them about how you think this money should be spent and educate them on the programs that you are doing, et cetera. We also want just sort of like a database for some kind of reporting standard to show some threads, like how are a lot of counties in X state choosing to spend their money and how can that relate to other states? I am not a researcher, but I imagine a researcher could use this information, in some way to come up with some reports a few years down the road. Because we know that it doesn't seem to be happening at a lot of levels. Some states have sort of thought about how they want to do this reporting, and I'm sure they'll have internal information. It's unclear how much of that will be public. So CEG is sort of doing what we can with the states that we work so closely in. I will drop in the chat if anyone's interested. We have a listserv called the Appalachia Opioid Remediation Listserv where we share updates, where we will be launching this spreadsheet that I referred to. If anyone's not already on that and is interested in opioid settlements, please join.
Right.
And
So
by the way,
commission, oh, sorry, go ahead.
some of those dollars could be, depending on the circumstances, some of those dollars could be the match that Tony is talking about for ARC grants. The Tobacco Commission, which was not the most efficient, wisest distribution of funds out there, the tobacco settlement, 3 of our states set up endowments, and quite often those funds are matches for ARC dollars to this day. Others of them used the money to plug a Medicaid gap, and it was gone.
Right. So when you think about the opioid settlement in Kentucky, Commissioner, what are you seeing or hearing, or are you guys working on it at all? Is any of that coming across your desk at this point?
No, it does come across my point, usually through the Department of Health, but we do fund some treatment centers, with our funds. So that's about as close as we get to it.
So, and Lauren, what is y'all's plan around like kind of big picture in the region, opioid settlement? Is there a conversation? Is there discussion? Why did you just give me that look of, Tony, why do you do this in front of me?
I know.
Why do you do
because you have to, and you're passionate and dedicated. I love it. No, I think, we are in full transparency. I'm listening to what communities and grantees are doing, what they're telling me. Trisha, your listserv is just the best thing out there, period. So thank you for all of the work that you put into that. And I would say I even have sent that to a ton of our other, states and grantees that ARC is not, and we just can't, delve into the space for right now. Should that change in the next year? Maybe, but I definitely would refer back to, what Guy said, is that we have some great models. And who is it in North Carolina? Guy, is it? What's the name of that entity?
The Golden Leaf Foundation, which was created by virtue of the tobacco settlement.
Yeah, and they are just a massive partner on a ton, at least a lot of the health grants that I manage out of North Carolina. They provide matching funds for almost all of them. So something to think about in terms of, states instilling and communities instilling models such as that outside of just ARC matching funds, but things that can, provide sustainability well into the future and be used in an evidence-based way.
Look at that! You got evidence-based way in the last sentence. That was good. I like it. Yeah, that was good. I like that. So here's the thing: we have about 5 minutes left. What I'd like for the 3 of you to do is to maybe say what you think you need from community, what you need from these partners out in the field. How can
Well,
we be of help to you?
For one thing, you can be informational for us. You know, a lot of times, you know, people complain a lot, but we never hear about it. And, you know, it's hard for us to help with problems if we don't, you know, if you all don't reach out to us. So our door is always open. In fact, when you come into my office, my door is hardly ever shut. I make sure that it's opens free for everybody. So we reach out and hope to learn from you all. You have problems that we don't know exist, maybe.
Got it. Lauren?
Similar to what the commissioner said, I think for me, it's constantly just looking for effective ways to stay organized on speaking with communities, speaking with our SUD and our health grantees on what works versus what doesn't. So many of them are, you know, they're all swimming in the same lane, various ones at that, but the same, you know, kind of ocean. And so it's just being able to take that information in and in the most effective way, then regurgitate that back to the entirety of the region. So we're not all spinning our wheels, right? And we're not reinventing the wheel because there's thousands of people that are doing exactly what we are all doing on this call right now. So being able to take that information in what works versus what doesn't, and then share that with the rest of Appalachia. If you guys have a great system of being able to do that, similar to what Trish does, I'm all ears, but also again, just, you know, call or email me. And if you want to have, you know, monthly updates, quarterly updates to tell me what's working because you guys are doing something phenomenal, then I will always be all ears to take in that information and be able to share it with our other communities in Appalachia, because that's what I'm here to do.
Perfect. And Guy, last but not least.
I'll just say Lauren's right on. Best practices, the thing we have, the first thing we hear from people is, can we get money? The second is, can you tell us somebody else who's doing this in a way that is succeeding? So the best practice examples from this large group here would be an enormous resource for ARC and fundamentally for the communities in Appalachia.
Perfect. And Lynn, I know you weren't officially on this panel, but Lynn, what are the things that people need to do, what you need from community to be able to access the resources? Because I'm going to imagine that you guys may end up with people not accessing the resources, not because you're not there to help and not there to do it. They just don't call you to get the help. What do they need to do?
I mean, I think at any point it's reaching out to communities and figuring out who's in the know. There's so many amazing experts all over the state, and folks who are on the ground and folks who are working on grants and folks who are building coalitions. If you can get to know those local partners, especially as they relate into the health system, you know, that's going to have to be a huge reliance as we move forward. So there's now certified peers all over the area, so, and all over emergency departments and things. So if you can get on those like calls with health systems or any of the DHHR calls, any of those webinars that they put out, hop on and you'll figure out who's working on projects in a certain region. And I think that's always great. And then every time ARC does a webinar, you find out who's working on great stuff, because they often profile a grant awardee in each of those meetings. And then it's both inspirational, but then you know who is working in that area. I don't think most people working in substance use are ever going to be offended to receive an email that says, hey, I want to work with you. This sounds great. Can we do more together?
Perfect. Everybody, I want to thank you so much for the team from ARC that gave us an hour. And I know an hour out of y'all's schedules is a big deal. So I really, really, really do appreciate it. And as I said earlier, you know, I think ARC is the epitome of government is in fact people. They're that you can touch them, you can talk to them. Like I said, they may tell you no, they may tell you that's not such a good idea, but that's what you also want. I mean, because it's not that they're telling you stop trying, they're saying here might be a different way or a better way. So again, you've got everybody's contact information. I think that we'll probably put out a little contact sheet with some of these things, the flyer that Lynn had, the email addresses for folks. I'm saying this and everybody on my team's looking at me like, girl, that's not what we do. And so, but that we'll do that for this because we want to make sure that you have access to these relationships as well. That's the point of these calls, is that, and I told you that our job is to bring money to the region so we can get the money to you. Our job is to bring resources to the region so we can get the resources to you. It is not for us to keep it. If that was the goal, we wouldn't do these kind of things. But the goal is not that. It's to share it, to find it, and to make sure that we all grow and develop, to make sure that we can help the people of the Appalachia region in health, welfare, and in their economic development and in their mental and behavioral health. So I want to say thank you to everybody who joined us today. Thanks, Len, for giving us an update on what all the work that you do. Stop shaking your head. And so again, thank you, everybody. Thank you, Commissioner. Thank you, Lauren. Thank you, Guy. I'll see you guys soon. And I think I should get a free registration. I'm just saying. All right,
Bye.
everybody. Have a great week.
Take care, everyone.
Bye-bye.